Ministry of Health modelling suggests the measles outbreak has not reached its peak and could continue to worsen for some weeks. There are now 914 confirmed cases of the highly contagious disease nationwide. 762 of those are in Auckland. Organisers of the New Zealand Secondary Schools Rugby League Championships have pulled the pin on the tournament, saying they can't risk the health of players and spreading measles around the country. But the Ames Games, that attracts about 11,500 intermediate age students, will still be going ahead in Bay of Plenty. Meanwhile, a series of vaccination clinics are being held in South Auckland this weekend. I asked Director of Public Health, Dr. Caroline McElnay, if the measles outbreak has got away on them.
Well, it's in a steep part of a curve, if you like. We always plot outbreaks using a curve, and we always have this period when you get a steep escalation of cases, and then it plateaus and comes down again, and so we're at that steep escalation of cases.
And how long do you anticipate that will last, that steep escalation?
Well, according to our modelling, and assuming that there's no sort of other things that happen, the model does show it coming to a peak, and that would be in the next couple of weeks. It could continue to increase, but then it would come down. That's what we've seen when we've had other outbreaks, but of course this is of concern because of the numbers of cases that we're seeing.
We have known that immunisation rates are not as good as they should be for a while now. So have health authorities in New Zealand done enough early enough?
We've known that we have the immunity gap in the older age groups, but for measles vaccine, the MMR vaccine is one of the vaccines that's fully funded, and it's freely available through primary care. And we have at every opportunity put out messages for reminding people if they're non-immune to go and get vaccinated. And we've used any outbreak or any case that we've had, because we have had quite a number of cases coming into New Zealand over the last number of years.
But people aren't listening, are they?
Message.
They aren't listening.
That's what we're getting the feedback, certainly in Auckland at the moment, that there are, despite the high numbers of cases and despite the message, and also despite the huge amount of work that has actually been happening and the response that people have made by going and getting vaccinated, and we can see that from an increase in the vaccines, what we're discovering is actually we do need to look at providing something extra, that primary care is not going to be accessed by everyone, and that's what we're currently working with Counties Manukau to help them stand up some of those additional services so that people can access those in addition to what's available in primary care.
Do you need some kind of powers of compulsion here?
Well, we need to understand first what really are the reasons for people not having their children vaccinated. What we're hearing and what the research that we've done is saying that this is not about a requirement to force people. It's about helping people make that actually go from hearing the message to doing the doing, and that's about helping people have more access to services. So that's our current focus. The discussion about whether or not we should force people to be vaccinated is certainly something that needs to be discussed. But at the moment, what we're very focused on doing is providing those extra opportunities for people and really continuing to encourage people to get vaccinated.
We've got a number of significant sporting events coming up over the next couple of weeks involving school students. Now, how worried are you about those?
Well, we're always worried about any large-scale public gatherings from an infectious disease perspective, because it can be an opportunity if someone is infectious for that organism to be spread. So we're certainly very concerned. We have given advice, we the Ministry as well as the local public health units have given advice to the organisers of those events. That's been happening for some time, so parents have already been given that information.
Have you
And, of
considered
course,
shutting some of those sporting events down?
That's always part of any consideration when you look at strategies that you might need to adopt. We're not at that stage yet of recommending or suggesting that those events would be shut down.
What would
We've
it
been very
take?
clear.
What would it take to close one of them down? What's the tipping point?
I guess it all depends on the nature of the event. The key thing for these events is making sure that people who are not ill, making sure that those people don't attend those events. The tipping point for shutting them down will have to be a mixture of how many more cases of measles that we get across New Zealand. It's always something that's a potential to be on the cards, but you have to balance the whether it's going to make a difference in terms of the measles outbreak that we're currently facing.
So I've been speaking to organisers from the Ames Games, and they say they don't have the power to ban students from the tournament who are unimmunised. Do you, as health authorities, do you have the power to ban unimmunised children from these sporting events?
Well, we've been speaking to the organisers of the tournament as well. We don't have the power to ban unimmunised students. There's certainly, at a local level, medical officers of health can require people who are infectious not to attend public events, but we've provided a lot of support to the organisers so that they know what to look out for, and to be very clear that if there are any students or attendees at the events who show symptoms, that they manage that very well and very quickly.
So to be clear, you can ask people or compel people to stay away if they are infected, and as I understand it, if they know they have been exposed to infection and they are unimmunised, that's the group of people you can ask to stay away or effectively ban.
Yes, we have to have a lot of evidence that they have the potential to spread disease, and those are the groups that we would focus on: those who are unwell or those who are unimmunised and who have been in contact with a case of measles. So they've got that potential to be infectious before they themselves become a case. So at a medical officer of health level, there are existing powers that allow you to exclude those individuals from an event. So it's rather than cancelling the event, it's about preventing some individuals from going to that event. The games themselves are not a risk if there's no one there who's infectious. So the focus for those games has been the students who are in Auckland, and that's where Auckland Regional Public Health has been working with those schools, particularly the schools where there have been cases, to give that advice as to which students should not travel.
And that's the Director of Public Health, Dr. Caroline McElnay.